PhysioLogic. Optimize health, optimize life.
Chubby here for PhysioLogic. You know, a few years ago I was in the same position as many of you are right now. I had fatigue, low sex drive, joint and muscle pain. I was overweight too. I also had problems with depression, short-term memory, and I really had a lot of problems sleeping. My conventional doctors told me, hey, it's okay, those things are expected, you're getting old. And I thought, hey, I'm not old. Well, okay, I'm older, but I'm not ready to be put out to pasture. So rather than accept my fate, I started looking around for some other options. I talked with a close friend who was enjoying great health and looked fantastic. In fact, he was 20 years older than me. And I asked him what his secret was, and he said PhysioLogic medicine. My natural reaction was, oh, here we go, some kind of alternative crap. Yet I couldn't deny his results. He told me he was on this program for several years. As he began to explain it further and I did my own research, things became more and more logical and clear. PhysioLogic medicine is improving and restoring the way the body functions internally. Using sophisticated blood tests and an extensive health questionnaire, PhysioLogic medicine can identify what your body needs to make it perform optimally.
What do people think about when they hear the word hormones? Generally, we think about only one thing, the most popular association, puberty and sex. But did you know that hormones are responsible for the vast majority of the day-to-day functions within your body? Your hormones directly impact memory and other cognitive functions, body shape, size and weight, metabolism, muscle tone, blood pressure, cholesterol, and overall heart health, immune system function, your mood and sense of well-being, sexual performance and libido, eyesight, skin tone and texture, and even mental health. As you can see, all aspects of your body are impacted by hormones. And did you know that hormone levels decline as a part of the aging process? And that imbalances can occur due to the use of prescription and even over-the-counter drugs, our polluted environment, intense periods of stress, genetics, or surgeries? What happens in your body when there is an imbalance or deficiency in hormones? This suboptimal state can lead to migraine and other types of headaches, fibromyalgia, depression and anxiety, diabetes, erectile dysfunction and low libido for both men and women, heart disease, bone density loss, weight gain, cancers, PMS, Alzheimer's, Parkinson's, decreased muscle tone, muscle weakness, fatigue, fibrocystic breast, memory issues, irritability, and mood. So what exactly is a hormone? It's a chemical messenger that controls a majority of the important actions and reactions inside the human body. Our bodies are made up of billions of parts which must function together for the good of the whole. Without hormones, this sort of cooperation would be impossible. So where do hormones come from? As you can see, important hormones such as testosterone, progesterone, and estrogens originate from cholesterol. Cholesterol is the reason you're alive. It's gotten a bad rap in recent years by the pharmaceutical companies who earn billions of dollars by selling you drugs, trying to lower your cholesterol numbers. In many cases, this makes no sense. Your mother's cholesterol skyrocketed in her body while carrying you so that you would develop correctly. Remember, cholesterol is the precursor to every hormone in the body. For this reason, cholesterol is generally higher in children because their bodies are making hormones in preparation for adulthood. We all start out with a similar shape. After puberty, we change shape after hormones decline. Testosterone is a very important hormone in both men and women. It is responsible for brain function, blood sugar regulation, muscle creation and tone, metabolism and fat burning, memory, heart health, prostate health, proper immune system functioning, libido and sexual performance. So when testosterone levels are not optimal, we see a deterioration of these functions. Did you know that the heart has the most testosterone receptors in the human body? It is important to understand that the heart is a muscle and all muscles need testosterone. Estrogens are a little more complicated than testosterone because there are more than just one. And yes, even men need estrogens. They are responsible for libido, heart health, bone health, mental well-being, blood sugar regulation, lubrication of mucous membranes, ovulation, stimulation of the central nervous system, brain function, skin, bone, muscle quality, female life expectancy, protection against coronary artery disease, osteoporosis, and Alzheimer's disease. Again, when hormone levels are not optimal, either due to natural decline inherent in the aging process or an imbalance created by many factors, we see a deterioration of these functions. So just imagine if many of your hormones are out of balance or deficient. Just think about how many problems your body can have and how you are setting yourself up for future disease states. By restoring your hormones back to optimal levels, we can potentially stop things from going wrong. Going back to hormone development chart, we can see an optimal hormone level in the mid to late 20s for a healthy individual within this age range. In order to balance or restore our hormones back to these levels, we use what we call PhysioLogic medicine. This is a combination of bioidentical hormones, vitamins, and mineral supplements that restore the body to optimal health. Bioidentical hormones are identical in chemical structure to the hormones you were born with. They have chemical formulas which are entirely identical to what is already in your body. Your body has receptors for them. It knows what to do with them, and it can cycle and eliminate them naturally because that is how your body functions. On the other hand, synthetic hormones are drugs and an anomaly within the body. They have chemical formulas that are not identical to those already in your body and can cause a wide array of negative side effects. Consider synthetic progesterone as an example. It can cause heart attacks and cancer, while bioidentical progesterone used in our program can help defend against these things. Cholesterol goes up as our hormones go down. It's that simple. As hormone levels decline, cholesterol creation goes up as a result. The body makes more cholesterol as a compensatory action to try to make more hormones. But the body's ability to actually create the hormones deteriorates as we age, and the conversion doesn't happen as efficiently. If you purposely try to lower your cholesterol with statin drugs, you are trying to fix the wrong thing, and you end up with less hormones than before, which causes even more problems. We've found, working with thousands of clients all over the world, that when we restore the hormones to optimal levels, cholesterol automatically comes down. It's like the cholesterol factory doesn't have to work so hard, pumping out cholesterol in an attempt to create hormones. When we give hormones that the body has been missing, the cholesterol level will drop. In many cases, statins can be discontinued, and the client no longer has to endure both the short-term and long-term side effects that are caused by those drugs. So how do we do this? Extensive blood and health history reviews. These are both observed to determine where the deficiencies and imbalances are. You can't do one without the other, and both are equally important. This ensures that each program is customized to the individual and addresses all of the client's issues. Designed individualized program. Once the whole picture is seen, an individualized program can be created. No two bodies are the same, therefore no two programs are the same. Furthermore, each body can react differently to the program, which brings us to the next most important step: continual feedback. Once you begin your program, it is crucial that we receive regular feedback. This is simple to do using our online system available 24 hours a day or a phone call to your program advisor. Remember, as you begin giving your body what it has been missing, your body will change. So of course, your program will have to change as well. Slight changes in your program can make a big difference in how you feel. So be sure to communicate with us on a regular basis to make the fastest possible progress toward optimizing your body. Follow-up blood test. After 3 months on your program, and typically every 6 months after, you will do a follow-up blood test. This allows us to get a measure of your actual hormone levels and see how they are improving, and to even better tailor the program to each individual over time. The proof is in the results.
It's really hard for me to put into words how I feel. I feel so good, it's hard to describe to somebody else.
It's unbelievable. I can't believe how well I feel. I feel so good, it actually scares me. It scares me so much that I feel so good. And basically I want to thank Dr. Zugan and especially my son for finding Dr. Zugan. And basically that's it. And thank you very much, and I'm glad that I'm still here to enjoy my family.
Zugan PhysioLogic. Optimize health, optimize life.